Good morning and thank you for joining us today. I am Staff Sergeant Martin Chivetta with the Calgary Police Services Drug Unit. I am joined today by Dr. Nicholas Etches, Alberta Health Services, Medical Officer of Health, and Corporal Brad McIntosh from the Royal Canadian Mounted Police. It has been widely reported in the media this week that fentanyl is a growing problem in Calgary and across our province. Today, the Calgary Police Service is coming together with some of our key partners to once again warn Calgarians that fentanyl is out there and it is deadly. Fentanyl is 40 times more toxic than heroin and up to 100 times more toxic than morphine. It only takes 2 milligrams of powdered fentanyl to kill a person, which is the equivalent of 2 grains of salt. The potency of this drug makes the stakes very high when people take it. We are working very closely with many different agencies to try and stop the trends we are seeing with fentanyl abuse. While Alberta Health Services is doing great work to address the medical dangers posed by this drug, we are working closely with other law enforcement agencies across the country, including the Canadian Border Services Agency, as well as the RCMP. An example of this cooperation occurred 1 month ago. A CBSA border officer in Vancouver found a suspicious package that confirmed to be fentanyl. The RCMP were immediately notified and began working with the Calgary Police Service on a complex investigation into the address where the suspicious package was meant to go. As a result of this joint effort, a search warrant was executed in the 2400 block of 14th Street Southwest, Calgary, where 1 man was arrested. In total, 122 grams of pure powdered fentanyl with an estimated value of $348,000 was seized and kept off the streets as a result of this investigation. Casimir Tayabi, 27, of Calgary, is now also charged with 1 count of importing a controlled substance. He remains in custody and will appear in court on August 17th, 2015. This is the 34th incident involving a fentanyl seizure in Calgary, compared to just 12 such incidents last year. This is a trend we are very concerned about, and we will continue to work with our law enforcement partners to address it. I would now like to invite Dr. Nicholas Etches to share a bit about what the Alberta Health Services is doing about fentanyl.
Thank you, Staff Sergeant Chivetta, and thank you all for being here today. Media are key partners in our work to attempt to reduce the harms and deaths caused by fentanyl and to increase awareness about this important issue. In 2015, we've already seen these deaths increasing. In Alberta, we've had 145 deaths in the first 6 months of this year alone. 45 of those deaths were here in the Calgary zone. We've also seen an incredible effort to address this issue. Most recently, in July, Alberta's take-home Naloxone program began. In Calgary, in the first 4 weeks of the program, we've already seen 1 life saved by use of these kits. We want to see this uptake continue. If we can hand out 1,000 kits in Calgary, it's estimated that we can decrease overdose deaths by almost half. But to decrease deaths, we need to sustain awareness. This week, AHS has launched a fentanyl awareness campaign targeting recreational users, Aboriginal communities, and entrenched users across the province. The campaign message is simple. Fentanyl is hiding in drugs that Albertans are using. Fentanyl is killing Albertans. If you are using drugs, don't be fooled. Visit drugsfool.ca to learn how to spot an overdose, how to reduce your risk, and where to get naloxone. You may think it will never be you, but one day it might be, and then it'll be too late. We want you to get the facts now. Thank you.
So myself, the doctor, as well as Corporal Brad McIntosh will be available for questions.
How much of the fentanyl is coming coming from Asia and China? Is it the majority of it, or or some of it coming from, pharmacies or,
Yeah.
things here in Canada?
From our research with other law enforcement agencies, I would say the majority is coming from China, although other sources may include countries such as Mexico.
What else can be done? We talk about this week, I've talked to a number of victims, and we've heard their stories, we hear about awareness, but it seems like people are still being used. Is there something on a regulation side that can be done, with regards to probably the importation of it, that needs to change, something systematic that needs to change?
That's some good questions there. Some of that I'm going to probably let Brad speak to for the national perspective. But in addition to obviously awareness, there comes education. And in Calgary, we are going to be working with our school resources officers. Obviously, we're going to be heading into school here in September. We have a training session with all the junior high and high school SROs coming up at the end of this month, so they're prepared to answer some of those questions from students. But the main message is here, and I know the doctor alluded to, there's no such thing as a safe street drug. In Calgary alone, we have seen fentanyl mixed with heroin, caffeine, xylazine. And I'm sure once we get more results back from Health Canada, we'll see other illegal commodities, deadly substances mixed with fentanyl.
Between 2011 and 2014, the number of deaths related to fentanyl in Alberta has increased by 20 times. Why is Alberta so affected by this problem?
Well, I think one of the reasons is our close proximity to British Columbia, where a lot of the powdered fentanyl is coming in. I think we'd be naive to think that there are not clandestine labs in British Columbia and Alberta that are manufacturing powdered fentanyl into tablets, and these tablets are killing people.
Can you just speak to the investigation, like the sort of succession of events here, about how the suspect came into Canada? Can you just draw out that chronology?
Sure. Obviously, CBSA intercepted a package that was from China. On the package, it had written the word muffler on it. They searched that package because they didn't believe the package contained a muffler. Inside was an unknown substance. They tested that substance. It came back as fentanyl. They contacted the RCMP, who in turn contacted the Calgary Police Service. Our investigation began. We were able to identify where the package was going to be delivered, and through a number of investigative steps, we were able to get the evidence needed to secure a search warrant and ultimately lay charges for the importation of a controlled substance into Canada.
So it was the package said it was headed to Calgary?
Yes.
How did it come in? By air, ground?
Well, it was intercepted by CBSA at the Vancouver Mail Center, yeah.
You've repeated this message over and over and over to this bank of cameras, yet the incidents are climbing and climbing. A, how frustrating is that? And B, how sort of much of a relief is it to hear that AHS is launching this campaign?
Well, certainly the police will not be able to arrest their way out of this problem. It is a health problem. It is a law enforcement problem. It's a problem for all of society. Is it frustrating? Absolutely. When you are going out, when the police, for example, or medical professionals are going out and telling parents that their loved one has passed away as a result of a drug-induced death, it has major, major impacts, of course, on families, on loved ones, on our healthcare system.
How do you think this is, like, and another means, are people, like, ordering this stuff online, or are people actively sort of just shipping it out here? What kind of smuggling is going on? Is it just people saying, oh, I can buy this stuff off the internet?
One of the challenges for law enforcement and CBSA is that it's fairly accessible on the internet to purchase fentanyl.
Do you know how many deaths there's been? Do you have any idea of how widespread the use is?
Well, I can say from my personal experience being the staff sergeant of the drug unit in Calgary, on a daily basis I am notified of a drug-induced overdose. Many of those people survive through the great work of EMS, but as the doctor alluded to, we've already had 45 drug-induced deaths in the Calgary area. But on a daily basis, I am notified of a drug-induced overdose in Calgary.
Not just fentanyl, but
Any drug, but I would say on a daily basis, it is fentanyl.
I'm sure you can only speak anecdotally, but what percentage of those that do overdose on fentanyl do you think know that that's what they're doing?
I would say the majority. It is certainly a misconception that if you're asking for Oxy, you're going to receive Oxy. Oxy has not been available since 2012. If you're asking for Oxy on the street, you will get fentanyl. And I would say the majority of our overdoses, people know they're receiving fentanyl. And taking fentanyl is deadly, and you may use fentanyl once or twice, but the third tablet will kill you. And you have to appreciate their fentanyl tablets are being manufactured in clandestine labs. There is no quality control. It's such a small dose that can kill a person. 2 milligrams, 2 specks of salt.
You say that there was 12 arrests at the beginning with fentanyl, and then it grew up to 44 arrests. And what drove this seizure?
Oh, seizures, sorry.
Seizures.
Seizures, yep. As in things they see in front of you.
Okay.
Yeah.
What drove this huge increase in?
Well, obviously, we have shifted our priority within the Calgary Police Service to focus on the distribution of fentanyl. Our priority is to identify a clandestine lab within the Calgary area or within our province, and we're obviously working very closely with our law enforcement partners to do that. If anyone has information on where a possible clandestine lab is, or if anyone knows that they're distributing fentanyl, please contact Crime Stoppers at the Calgary Police Service. I know the doctor also has a number. If anyone is dealing with an addiction to fentanyl or fentanyl abuse, there are resources available for those people to seek help.
You mentioned working with your SROs in the coming school year.
Yep.
Is that plan still being formed, or can we expect to have those SROs addressing assemblies?
Yeah, absolutely. Our SROs will be informed with the latest information going forward into the school year. I know Sergeant Dwayne Lepchuk, who's sitting in the back, may be available for some questions in regards to how to speak to your kids regarding drugs and some obviously the problems associated with taking drugs.
So this is just a regular sort of liaising with teachers, but the message now is fentanyl is the issue?
Well, it's going to be about all drugs because I know we're focusing on fentanyl today, but we have other drugs abused in our society. Of course, methamphetamine, MDMA or Molly, heroin. So we have other toxic drugs out there, but today obviously we're focusing on fentanyl because it's so toxic and so deadly, and obviously there is awareness about that now. We want to capture that and make sure that our school resource officers are fully informed when they're speaking to our young people.
Do you know how many pills this individual could have made or numbers?
Yeah, up to 17,000 tablets.
And how much do those go for? Tablets?
Yeah, in Calgary right now, it's approximately $20 per tablet.
The cost to them would be
I don't know the exact cost, but the profit margin would be extremely large. Yeah, and of course the price of those pills varies in our province. Yeah.
And the difficulty to get drugs like Oxy open the door to a drug like fentanyl?
I think it's created an opportunity for fentanyl to be abused. Absolutely.
I have a question for you.
Sure, I'll turn over to.
Hi.
Hi. So in my introduced this new medicine called Naloxone. I just want to know what are the results since you started implementing this?
So, like we said, we implemented this July the 7th in Calgary, and it's a provincial program, and so we've already reversed an overdose here in Calgary using the kits. I know that other reversals have occurred across the province as well.
Do you have any idea of the numbers, like how many people have been saved by Naloxone since you started implementing this?
In Calgary, again, I can say that we've saved a life already. In the rest of the province, I don't have those numbers available to me, but we can see if we can make those numbers available for you after this.
Do you have that kit? The program that kit?
Yes, and so there's a good amount of evidence out there to inform us as to how many kits you need to get out there on a population level in order to reduce the mortality from opiate overdose and fentanyl overdose in this instance. And so the amount of kits that Alberta Health has provided funding for are an evidence-based number.
How many in one kit, or do you need several doses, or is it campaign?
It depends on the overdose. So again, with naloxone, the kits are given out. They're prescribed by a physician or nurse practitioner, and they come with training. And part of that training is how do you use the naloxone. And so first of all, the first thing is to see if someone's unresponsive, call 911, administer rescue breaths. But after that, it's to administer one dose of naloxone, and if that is ineffective, then after a few minutes, then to add a second dose if the first dose is ineffective. So it does depend because as you know, then people might take different amounts of drugs, and so different amounts of naloxone might be required in each case, and that's why each kit actually has 2 doses of naloxone.
How long, you have to, sorry, keep the time frame after, is it very, I've heard 20 to 40 minutes, is that correct?
So it's usually with naloxone, the drug will take effect in 1 to 4 minutes. The drug itself, the naloxone, will reverse the overdose for 30 to 60 minutes. The issue is that many opiates have a longer half-life than that. That is, that they last longer in the body, and so the person's overdose, once the naloxone wears off, can actually reoccur, and so that's why it's important for responders to call 911 and seek medical attention immediately.
Whose hands do you need to get these kids into?
Pardon?
Whose hands do you need to get these kids into to start speaking?
So these kits, they need to be in the hands of, they've already been used throughout Alberta Health Services and in medical facilities, EMS, for a long time. But now our effort is to get these kits into the hands of the people that are using the drugs, because many overdoses, the majority of overdoses are witnessed, and it's necessary to have a very fast response. So we need to get these kits into the hands of the people that need it most.
I mean, the agencies selected so far have been for people who are quote unquote at the highest risk, kind of marginalized addicts, so to speak, hard to reach populations. Stats are saying that more 2/3 of the victims have been from suburban communities. Middle class kids not going to walk into HIV Calgary looking for naloxone kits. And how do you target that population?
Well, that's why media as partners, and as well this fentanyl awareness campaign is so important, because these naloxone is available throughout the province to anyone that is using opiates. We've got as part of our awareness campaign, we're targeting recreational and club users as well. So we've got physical advertising in restaurants as bars. We've also got some digital advertising as part of some upcoming music festivals. And also we've got an online media campaign that's targeting things like social media using geographic specific advertising within 250 meters of bars, restaurants, or other social gathering areas where people may be using these drugs. So we are attempting to get the message out there, and that's why it's so important to increase awareness and to make sure that everyone knows that naloxone is available and it's safe and it saves lives.
Question is for both AHS and police. Doesn't it appear apparent, though, that we're a little late to the party? I mean, I remember I started reporting on this issue in January when there were 29 deaths in 2012, around 60 in 2013, and at that time around 60 in 2014. Those 60 other deaths ended up getting reclassified. Now we're at the 120 number, but still 60 deaths in a year across Alberta. It's a pretty serious issue. Now we're like halfway through the year. The issue is just spiraling. 45 deaths in 6 months. It's insane. Don't you feel like we're a little flat-footed here? Why didn't we act faster?
So Alberta Health Services has been operating 2 opiate dependency programs in Edmonton and Calgary for a long time now. There's 7 harm reduction programs in the province that have been operating for many years, and the Alberta Health response to this issue has in fact been quite timely. So I presented this data about fentanyl deaths to the Chief Medical Officer of Health in January, and within a month we had funding and approval for a program, planning, and then implementation, and so we rolled out the program in July. So the timelines on this have actually been very tight, and we're really excited about the naloxone program and the potential to save many lives based on the evidence that we have.
Can you please respond to that, too?
And I think it was alluded to already, but we've been on this podium before, and are we surprised by the increase or the abuse of fentanyl? I think that unfortunately organized crime has captured on the potential profit margins to be made from fentanyl, and see that opportunity. So it's obviously very challenging because what we're dealing with is a drug that's not locally produced. It's imported, and we need the help of our provincial, national, and international partners to deal with it.
The message I was again, I've been covering this story since January and February. The message I got from your communication staff was not really an issue here, not really an issue here. And then in February or in March, something like that, there was a warning from police. I mean, why did it take so long to catch on?
Well, I think it's, working in collaboration with the medical examiner's office, with AHS, talking to our law enforcement partners to really capture the problem. And I think we have a good idea now. We're starting to see now powder come into our community. That's a new trend that we haven't seen before. So it is very challenging to keep up with fentanyl, with the distribution. And we're certainly doing everything we can to, identify the labs that may be operating in our community.
Would you say that the people who believe in a harm reduction strategy of having drug testing kits available at, say, bars, clubs, music festivals, things like that, so they can see what substances are in the drugs they're taking?
Well, the message from the police is no such thing as a safe street drug.
But isn't it a little bit, wouldn't you say that it's already happening, people are already doing it, so maybe it would be a deterrent to have that? I mean, yes, obviously no safe street drug, but we're offering kits to reverse overdoses. What if the overdoses were prevented by somebody seeing that there was fentanyl in their drug before they took it?
And I've been asked this question before, and if someone obviously is experiencing an overdose, we never want anyone to be reluctant to call the police because they're fearing some sort of retribution or that. Obviously, the most important thing is to seek medical assistance, and that's the advice we give. As far as having drug testing kits, the challenging thing with any of those kits is keeping up with all the different types of drugs. And even working with Health Canada, it is very difficult for us to know what is in those substances.
I have a question maybe for the audience.
Sure.
How does Alberta compare to other provinces in terms of the spread of fentanyl?
Sorry, Alberta compare across the country with the rate of
How does
fentanyl?
Alberta compare with other provinces in regards to fentanyl?
Well, I think across the country right now, our big issue province would be British Columbia right now, just because of the location of the ports. And that's the point of entry for a lot of the fentanyl powder coming into Canada. With proximity to British Columbia is Alberta. So Alberta ranks right up there. Then across the country, it impacts us, right? It gets distributed across the country. I don't have exact data on numbers on cases per se, but fair to say it's not a localized phenomenon in Alberta and BC. This is affecting Canadians across the
Are
country.
you aware of the labs? Like, what should we be looking for? Can you just make this in your bathtub, or is this require like a meth lab? Like, what are we looking
I
for?
think to be fair to describe it as a lab, the staff's describing it as a lab. It's more of a reprocessing facility, I think. I'm not sure we're seeing a lot of production per se of fentanyl in Canada. It's being imported in powder, and then, correct me if I'm wrong, it's being reprocessed into tablets, right? And it's tableting, so we're getting pill press machines imported into Canada, and different groups or individuals are using those machines to re-image, I guess, with this fentanyl powder into something that's more attractive or comparable to represent, say, these oxy tabs, right? The oxy 80 tabs is how they're quite often marketed right now.
So do we, is there any regulation changes that need to happen with regard to importation of powder substance, or even the tablet makers, or what needs to change other than public awareness?
Well, within Canada, right, fentanyl's a controlled substance, so it's not supposed to be here to begin with, other than prescription format for its intended purpose. We're working with our international partners, with the DEA. We're working across the country with the Canadian Association of Chiefs of Police. We're working with our Intelligence Service Canada. We're working with our municipal and regional partners to come up with, as you say, an awareness campaign, an education strategy. But internationally, there was comments made by my national representative, Corporal Luc Chicoine, in Ottawa, addressing some of the points that you just made for our international partners. And you can rest assured that the RCMP sees this as a serious problem too, because it's not just your major centers this happens in. We are working with our international partners to come up with strategies and to educate them the impact on what product might be produced in their country would have on other parts of the world as well too. So
Are there more members, or are you adding more people?
I don't have that information, but if you're interested in that, I can certainly put you in touch with our media people to come up with that.
A question for our AHS representative. I'm sorry, your message was that these kits are safe, they're effective, and they save lives, and they're available everywhere. Should that be tempered with caution, or do you not worry at all that there are young people out there that they, well, I got this kit, so I'm safe to do this at Friday's break?
Right. So I mean, there's take-home naloxone programs are there's 180 programs in the United States, and it's on the World Health Organization list of essential medicines. And there's no evidence that this increases risk-taking behavior or causes someone to feel like they are okay to overdose. This is the evidence tells us that this reduces the number of deaths due to overdose and does not increase risk-taking behavior. So it's an important point to stress.
Okay. So if you do have further questions, we can maybe just break off now. And just to clarify, sorry, what's on the table, these fentanyl pills were not part of that seizure that's in the news release. These are just here so you can see what fentanyl pills look like. What was seized was powder, and that's too dangerous for us to have with you. And then this other black thing is the naloxone kit that AHS is distributing. So if you have any questions, feel free to...